And Heather, so I'm going to share the slideshow with you separately to send out, because since you said it would probably make more sense to talk more about the registry, I thought I would show the internet and do it that way.
Great. Yes,
If
that would
that's
be wonderful. Lisa, y'all, Lisa had this big presentation and you can share it all. And I said, this group, the first part was just like, what is ACP and why is it important? And I said, okay, this group's going to know that. And so, but it's great to have, it was a really good presentation. So you can share the fullness of it. But yeah, I said, focus the most on the registry.
Well, and it's just it's comprehensive, which you guys are all healthcare professionals, but I've been married to a lawyer for almost 30 years, so don't hold that against me. But and even then, I didn't know about advanced directives. I didn't think to tell my mom about having one. So, just because I'm in the legal field doesn't mean that I was privy to or understood how important these documents are. So that's why kind of the presentation is more geared toward that. And even as I'm going out into the community, it's really hit or miss. I'm sure you guys know this. I know Heather does. Some people have their documents. Some people have no idea what I'm talking about, and trying to explain the difference between a healthcare power of attorney and a living will is challenging at best. But so a brief history is, as I said, 25 years ago, the legislature decided that we would be the repository of advanced healthcare directives. And I think that a lot of health professionals and health systems were the drivers of that. Although, again, as it was clear last week, nobody's quite sure. But for 25 years, we've been doing this. Taxpayer money does not support it. The $10 registration fee does. So it's a voluntary online database created by statute in the year 2000. It's kept here mostly because we're a very safe and secure repository of business documents and have been for a very long time. It's easily accessible, and the four directives that they charged us, health directives, are the healthcare power of attorney, the living will, and advance instruction for mental health treatment, and the organ donation card, which most people use the DMV to do that. The healthcare power of attorney is by far the most popular one. Let's see. The online registry just provides another set of eyes. And the reason that's kind of interesting is right now, so for the past 25 years, in the first year, I would say maybe 200 people sent their directives to the registry.
Mhm.
And last year, it was closer to 20,000.
Mhm.
Again, the main one people are sending is the healthcare power of attorney. And the main people using this are law firms. So even though this system is available for anybody over the age of 18 in North Carolina, law firms seem to be the only ones that realize what a good deal it is, why it's a good, thing to do. And what's really funny is that they're using our forms. So all these four forms are available on our website for free. The $10 fee only comes into play if you're actually going to send it to me into the registry. And then when you do that, you're going to get one of these cards. It's just a little card, and I'll show you this again on the internet. But you get it has your name. Can everybody see this? And then some registration information. And what's new is the barcode, so that you could actually scan it on your phone.
That's cool. Hey, Lisa, did you actually have slides that you wanted to show, or are you just talking about it? Because I wasn't sure.
I do have some, but mostly I was just I
Oh,
thought I would hop on the internet and share it that way. But I might need
oh,
your help to.
whatever. Great. Whatever you want to
Okay.
do. I just wanted to make sure, but super helpful. Keep going.
Yeah, no, it's just and so these law firms, right? The ones that are definitely not charging only $10 for the forms, and as I said, they're using our forms. I know because they're on the website. They're created by lawyers, but and they're not, and I'm not going to get into your mission, which to remove administrative burdens, which I think is really good, and thank you for doing that. But so we get all these forms from law firms, and a lot of the lawyers are notaries themselves. I know, Heather, you said you're a notary, and they will forget to stamp the last page, and so yeah, so that's what it means by just having another set of eyes. Because then, I'll call the lawyer up and say, "Hey, can you email me that last page because the copy that you sent me?" And they'll realize, oh, we didn't stamp it either. So that's just where it's a good idea to have it. We get lots of phone calls from people who, even though they used a lawyer to set it up for them, and they have a copy of their document. They either can't get a hold of their lawyer or they can't find the document. And so because they have this card, they can call me and I can email them the document. And I can't tell you how many times I get calls. People already have somebody in the hospital. And so it's, the registry is available 24 hours a day, 365 days a year, that sort of thing. All right, so let me, so I have to hit share screen.
Yep.
Is that right? Okay, and then can you guys see this?
It takes a moment. So you click your share screen, and then once you see what you want to share, you click share again.
Okay.
There we go.
All right, can everybody see that?
I see that. Great. Thank you. I think
All right,
others
and
do
so
as
it
well.
is our busy season. So when this is our main website, sosnc.gov. And that big square, that's just because most limited liability companies and business corporations, they owe their annual reports right now. So that won't always be there, but we're getting about 2,000 calls a day asking why their annual reports. So that won't
I
always
just
be there.
submitted mine a few weeks, 2 weeks ago. So yes.
Good job. Thank you for doing that. So anyway, at the top, you'll see divisions. And so you would click there. You can see right there, it says advanced healthcare, which helps for the first ones. And then right here, I'm going to type in the information for my directive just so you could see. If you were home and somebody just went to the hospital and you're like, oh my gosh, I don't know where the document is, you're panicking because, so then here it is. Anyway, so you see how easy that is. That's how quickly you could get it. I'm gonna go back. And then below that, let's say you didn't have one yet, you had questions, you could go here, but it's here on the download forms part that you'll see. Here's the brochure. Here's the registration form. This is a removal form. To remove it, there's no charge ever. And that's when people, like if somebody got married or they had never been married and they got married and they changed their healthcare agents. So that's on there. Here's the healthcare power of attorney, the living will, the mental health directive, and the organ donation card. And then it talks about fees. I'm going to pull up the brochure. No, I didn't mean to pull that one up. The registration form lets people know up there. It tells you where to mail it. Right now, it's one of the few things we're not set up to take online money for. So you actually have to mail in a copy of your document with this registration form and a check or money order. And then, as I said, 99% of the ones I'm getting are from lawyers. And so they're wanting the document to go back to them. But part of my mission is to go into lots of areas and let people know that this is available to anybody in North Carolina over the age of 18, and not just our seniors. I'm trying to get on college campuses because I don't know how many of you have college children, but I have two. One's in Oregon, one's in Massachusetts. And just because I'm their mother, as you know, doesn't mean I'm necessarily going to have access to them if something happens. So that is the registry and the website, and it's pretty easy to use. Did anybody have any questions about that?
Oh, there's lots of questions.
Okay.
All right, so let's start. I've been keeping track of them, and they're my questions as well. So the first question that on the chat, so there's three of them, and then we'll go to you, Betsy. I see you as well. What is the status of adding a practical form for all adults since so many of us are using this form?
That's a really good question. I know Ann Elmore, who is one of the lawyers who works for the North Carolina Secretary of State, and I failed to mention I am not a lawyer. I've been married to one, so I like to think I've been in law school for almost 30 years. But so Ann Elmore, I think she was working with you, Heather, to work with the legislature on that, and I'm not sure why it stalled, but it doesn't seem to have moved forward much here. Again, because there are so many unfunded mandates that are kind of dumped onto the Secretary of State's office, and we have, almost an 18% vacancy rate. So we just don't have enough people to do all the things that we've been tasked with doing. So
Well, it isn't interesting because I want to go to Jennifer's point that she put. So, and when I pulled the ACP Educators Collaborative, and there were 18 people from I think 12 different organizations, we were all using the practical form. And what seems simple to us of just, well, the PDF's there, we get it from you. I'll just have someone just upload it. But what I think Jennifer's point's a really good one. And what she wrote is we use the practical combo documents because the practical form has both the healthcare power of attorney and the living will. And she
right.
had a patient and her daughter and their daughter bring in the standard form from the Secretary of State's website. And they kept pointing out and the sense that the practical form was less legit. And so
the customer was saying that the practical form was less legit.
yeah, and Jennifer, feel free to come off mute if you want to add more, because I use mostly the practical form, but since I'm a notary, I did recently do the standard form or the statutory form.
Right.
Yeah,
Jennifer,
I
you want to
had a
add?
daughter. I set up for National Healthcare Decisions Day and had a patient and daughter come in, but they brought their own forms instead of using the practical forms that I had. And she kept like repeatedly saying, well, I printed these from the Secretary of State website. Well, I printed these from the state website, as if the practical form wasn't as legal or was less than in some way. So it's just, I think, a perception that maybe one form is not as good.
Yeah, I think you're exactly right because we all know that you could write something down by hand, and as long as it had witnesses and a notary, it would be legal and legit.
That's fine. Angela asked a good question, and Betsy, feel free to come off mic if your question's also about the practical form. Since the one that we all use says 2014 on it, have there been any updates to the practical form, or is that the one still, that 2014 version?
The ones on the website?
No, actually, Lisa, you don't work with the practical form at all, so this might be a question for the rest of us.
Okay.
I'm still using the 2014 version. Has anyone seen a more updated copy? Okay. And then the last question from the chat, and then we'll turn it over to Betsy. So Angela, I think the answer is no, no, I don't think there's been updates.
Our legal team has reviewed ours as late as 2023, and we put that date on ours just because it's been reviewed by the legal team. But as far as statewide, I don't know of any updates.
Okay. Got it. And I thought when I first went to the Secretary of State's office, when I first started this work, I don't know, a year and a half ago, I thought the practical form was on there. I don't know where I saw it downloaded, and then I looked again and it was the statutory form. So I am sort of curious about, so for you, and then do you have ECU Health on it, or does it still just say a practical form, Vicky, but then at the bottom, instead of 2014, it says 20?
We do not put ECU Health on it intentionally. It is a state form.
Yeah.
But we have our cover sheet has ECU Health on it, but the actual documents do not.
Okay. So then one last question from the chat line that I saw. What happens when someone loses their card? Angela asked that lovely card you showed.
That's a great question, and it does happen a lot. So that falls under the frequently asked questions, but basically they will just print off and submit another registration form and ask for duplicate cards, which is half the price of the original file. So originally it's $10. Let's say they had a healthcare power of attorney and the living will. So to get duplicates of both of those would just be $10 for both rather than $20.
Mm-hmm. All right, Betsy, you've been patiently waiting.
Well, I may be asking something. Well, anyway, let me just say. So in my organization, we always promote the 5 wishes form, and then lately I have co-presented with a bunch of attorneys who tell the group, well, that's not legal in North Carolina, which drives me nuts because if the driver's license is legal, so is the 5 wishes form. So in order to address that, And also to address the fact that often when I speak to people, even my coworkers at a hospice organization, they say, I don't know what to write. I don't have time. And so I thought, well, let me just go to the state and do the healthcare power of attorney only form. And I was really shocked to see that that's 7 pages as opposed to the living will form, which is 4 pages. So my question is there any move afoot to do a shorter, more simple healthcare proxy form so that people can at least just do that, even if they're too overwhelmed to do a whole advanced directive?
Right, Betsy, that is a great question. Again, anything that's happening with the forms and the forms that we have, it was all created at the legislature. The same ones who last week asked our boss why we're doing the registry. So we don't have any authority to do anything they haven't mandated. It's not as if we created these forms and put them on our website. They had committees and people to do it. So
Yeah,
unfortunately.
it was a funny email interchange between Betsy and myself, because she emailed, she's like, is it really 7 pages just for the healthcare power of attorney? And so I looked, I was like, yeah. Since I also am looking at the HB 349, which is the current bill to update the advanced healthcare directives statute, within that statute, the one that we're trying to get it to go from 2 witnesses and a notary to 2 witnesses or a notary, and the ability for electronic sharing. Later on in the statute, it does have the form. So the form was legislatively, and Lee, tell me if I'm saying this wrong, it's literally within the statute what form. And so
Yep.
I think, Lisa, it's probably out of your hands. It would need to be, well, there's something for the oversight
We don't
committee.
create anything. Everything we do is by permission from the legislature.
And that
Got it.
form is the one that's in it. But it doesn't mean that other forms are not accepted. As we know, lawyers do their own version oftentimes, which is just redoing what's on the statutory form or on the practical form. I see
Right.
often. But Betsy, it is in the statute, that specific 7-page.
Okay.
Healthcare
Well,
power of attorney.
Okay, so then this question isn't so much for you, but just for the group. If somebody has an example of a shorter form, because I'm doing an employee event on next Wednesday, and I was thinking I have to copy, 50 copies of this 7-page thing. If anybody has a shorter idea for just who's my healthcare power of attorney is, email it to me.
Is there, well, now we're getting into your business there. Is there a reason why not, like I have hundreds of the practical form that we copy. Is there a reason why you don't just want to do the practical form? Or are you trying to stay away from the living will part of it?
The
Well,
practical form has an option to not complete the living will page. You can initial at the top and say you don't wish to complete it if you only want to do
Yeah.
1 page of it.
Okay, and so the practical form is the 4-page form?
It's 5 pages with the 2 pages of instructions. So, and I was always told to keep the 5 pages together, but it's really 3 pages, A, B, and C, if I'm not mistaken.
Okay, and is that, I don't know, that's the one that's on the Secretary of State
No,
page?
No.
Okay, that's why I'm so confused. Heather, could you just send me a link to that practical form? Because
Yes.
I've been no, now I get why I'm so confused. I'm like,
I will send you the PDF, and that's what I'll try to, I'm gonna try to add it to this message in just a few moments. So, and as Jennifer, I think it was Jennifer that said it, you can either at the top of part C say, I don't wish to fill it out, or just literally just slash it out, that page, because it doesn't necessarily mean that they don't want to have it. It's just, well, it just means they don't want to fill it out now.
And that's a good
Oh wait,
point.
thank you, Jennifer. You're the best. So there it is.
And Betsy,
Awesome.
I was going to say, yeah, for sure, the practical form. But so our forms too, just to go kind of back and forth, the forms that we have on there. So the 7-page healthcare power of attorney, again, what we post on our website has to be by permission from the legislature. But they're set up in such a way, there's a PDF and there's also a Word document. And a lot of lawyers actually do this. Again, law firms and lawyers seem to be the only ones who realize what a good deal the registry is, but they are taking our healthcare power of attorney and the living will and kind of combining them into one document. So instead of it being $20, it's only $10. Again, you know,
Mhm.
and they're not, but again, so it's neither here nor there. But so you could take our 7-page healthcare power of attorney, you could delete that whole first box that talks about the explanation. I feel like that takes up a whole page. You know, like Heather was saying, you can format it however you wanted. And in fact, when I submitted my own healthcare power of attorney to the registry, and I had my kids again from Oregon, my college kids from Oregon and Massachusetts, I kind of tailored it the way I wanted it to, and I shortened for number 5, for example, the special provisions and limitations. I just deleted that since I wasn't going to initial any of it. And same for the number 6, the organ donation, because I have that on my license. You can make the document your own.
Okay, I'm learning so much because I am a notary, but not an attorney.
Right. And again, because so as a state agency, we can't change the document. But, you know, part of it is also they're just trying to get this information out there through you guys, through us, so that people will start doing it. Because as we know, not enough people are making these decisions or even having these conversations. But you can take this 7-page document, you can delete provisions, you can add provisions. But does that make sense?
Totally. Yeah.
It's a go by. It's a form, and you can make it. You can make it longer. You can make it shorter. You can't change the witness and notary parts, but you have a
Right.
lot of freedom to play around with the rest of it.
So I think you all can see this, right? Am I doing?
Right.
So
Yes.
Yeah.
Jennifer, Rockstar. So the first 2 pages are the instructions. And then this form, this version is the fill outable one online. I can also try to attach the one that is for printing that, or you can just print this one out, but this one allows people to fill it out online. But since you're going to be handing out, you may want the one, this might print out just fine. So we're
Mhm.
going through, so if you can see where it says Part B, Living Will, and it says, this is what Jennifer was saying. If you do not wish to prepare a living will, strike through this part and initial here. So you just
Awesome.
initial it, and then, you know, just literally just take a pen and go. Shwah.
Yeah.
Um,
Awesome.
And then what I always see that people do, and Lisa, I'm so glad you made the point about people, especially attorneys, sometimes won't fill it out correctly. And I put in the chat, Jessica is our amazing fact checker. She goes through everything that gets submitted through our Mind My Health. And people do, there are problems sometimes with the way, so it really does need another set of eyes to verify. And the issue where I see people messing it up a lot because it's confusing is you do the signature of the witness up here, and you always have to make sure the dates, that's an issue. People sometimes do different dates. And then down below, you have to print the name of the signer and the witness. And so they don't sign and print in the same part. It's a slightly different part. And that seems to really mess with people's brains, if that makes sense.
Mm.
And then there's where the seal goes down there. So I'll stop sharing. But so this was, and where it says revised, see how it says 2014. That's why we were all mentioning that 2014.
Got it. Oh, so helpful. Thank you.
And Betsy, if you do use that practical form, our attorneys have told us you have to print page 1 and 2. That is a part of the document. Not to
Okay.
leave those instructions off. That it's not
Got
a
it.
valid document without those first 2 instruction pages.
Thank
Just
you.
FYI, because we didn't know that at first.
Oh, and we, in our training, we do that too, because we also have our own system through Mind My Health. And when you're scanning it, or even if your people are scanning it and sending it to the Secretary of State's registry, it has to have all 5 pages. And so we tell people that too, because they want to just rip off the first 2 pages. But because it says page 1 of page 5, page 2 of page 5, it would leave a hospital like, well, what was in the first 2 pages? So that's why you have to, is my sense, why you have to keep it all 5 together.
Mhm.
Lisa, question about, as I understand it, oh, I have 2 questions. So people put this up on the registry, and that's for them to be able to access it. But right now, because of the no electronic sharing, the Secretary of State doesn't send it to anyone. You don't send it to health systems or to the Health Information Exchange. It is purely a repository, a registry for people to have access to it or their attorneys.
Correct,
Correct.
because that's how the statute's written. Again, we
Yes.
have zero freedom to do anything beyond that. So if, you know, and I know that that conversation is happening where, you know, we have our legislative aides and our in-house counsel are paying attention to that because, yeah, we don't have permission to share it beyond that.
Do they want it? Because let me know if they're saying anything different, because this is key part of HB 349 is being able to electronically share it. That's the other part. So that way, if people do register with the Secretary of State, it could be shared with the Health Information Exchange, which then can send it to all of the health systems.
Right. Yeah. No, most people I've talked to definitely want it.
Okay, good. Because I was like, let me know if anyone's against it. Because
Yeah, no, people do. Again, it's just, you know, the people to do it, that there's, you know, everybody's doing like 50 jobs. Even though this is my job mostly for healthcare, I'm answering the phone for people wanting to file their annual reports because
yes, that's where we are right now.
yeah.
And then my other question, and then I want to go to Vicky. When the attorneys are sending it on behalf of their clients, are they paying the $10 fee? Like, I'm sure they've passed that fee on, but is it that the attorneys are sending it with the $10?
Yes, they're almost always a firm check.
Yeah, and y'all know.
Oh, I know, because
My
I'm
attorneys,
married to a
but you
lawyer.
know they
Yeah,
are not, they're not
they're not
charging
charging $10.
they're
Yeah.
not charging $10. They're charging, you know, 200, 300 because it's $10 and then the associate's fee for the time of that, which is why when we went to update our advanced care planning documents and our will and all that, because our daughter turned 21 and we were like, congratulations, you get your little sister and you get to be in charge of things. It was $3,000. And my
Yeah.
husband's like, what? Just to do a few updates. So those of
Yeah.
us that are doing it for free, even though it's just the healthcare part, not the will part, it is a substantial savings.
Yes.
That part.
Because
Vicky,
again, even if you don't use the registry, I mean, you guys are all doing this too with the practical form, which is great. These forms are available for free, you know, and you can download it, you can change it, you know, but
and just per note of this, it does make me think, and Jessica, you're on this, with our website, we, in our Own Your Own Health and our advanced care planning resources section, we just send people over to the Secretary of State. But Jessica, I am thinking we should probably put a link, if it's okay, to the North Carolina Advanced Directive, what Jennifer just sent, that practical form. So that way it's on our site as well, so people have access to the quicker form and the full form.
Okay.
Thank you. Vicky, you have been patiently waiting with your hand up.
Yeah, I'll probably forget my question, but it's okay for us to send the practical form to the registry. Is that correct? Based on what you're saying, that you can adjust the statutory form.
it
So we
is
can,
correct. Yeah.
if our patients or our customers want to see it, send it, we can still use that resource and just send the practical healthcare power of attorney and living will, and that would count as one document. Is that what I heard you say? If it's a combined
Yeah,
document?
the few practical forms that I've seen where people are choosing both sections, yeah, that's just $10 because it's a combined
Okay.
document. Mhm.
Okay. And I will tell you, when we were using the statutory forms, nobody knew what they were signing. It was very confusing.
It's very
Yeah.
confusing.
Yeah.
Yeah.
Anyway.
I had to look at it a few times and I was like, you know, because I wasn't used to it.
Yeah.
Destiny has a great question and I will answer it and then hear how other people answer it. Are there any forms for durable power of attorney? So that in that case, well, durable can be in either one, but the durable power of attorney for healthcare, I think you mean the durable power of attorney, the financial one. When I've had to do it for other states, like I'm in Colorado right now, and so you can literally just type it up. And a lot of these legal websites, you know, they have them, but I went on, you know, sometimes you have to go through their system. So I was able to find, you know, you find the ones that will actually just share the form as opposed to having to go through their, you know, you can sometimes fill it out there and then they charge you a little bit of money, but all the forms are findable. I don't know if people have a quicker way to find it. I just Google it, North Carolina financial power of attorney or durable, and then look through the options and see which ones are the templates that you can print out.
And State Employees Credit Union also has a lot of those forms.
That's
Yeah.
where it's like you need a non-legal, like something that's a resource.
For financial. We again, it's all mandated by the legislature. We don't have anything they didn't give us permission to have. So right now it's only healthcare related directives.
Mhm.
And we do have occasionally people will send us their financial power of attorney, and I have to return that and explain that we're not keeping that.
Yeah.
But people file them with the Register of Deeds, and but I do know the State Employees Credit Union has a lot of those kinds of forms.
Yeah.
They have the state planning department, but they'll do a simple will as long as there's nothing that's going to be contested. There's no
Right.
sanction because anything out of the ordinary they don't want to get involved in. But it's very reasonable. It's a very reasonable price too.
And I'm warning you now, Betsy, if you look at it, the durable power of attorney form for the finances is a longer form. And in some ways you kind of want that because it goes through a list of things. And sometimes just like that, the reason why the statutory form for healthcare is longer is because it starts to put some it has a little bit of the living will language in the healthcare power of attorney form because well, what about for this? And what about for this? Are you fine or do you want to take out any powers? And for the same thing for the financial power of attorney, but it really gets very specific, real estate and transactions and banking things and charitable things. So that one it's not bad if it's a little bit longer because you want to make sure everything's in there that you want to be in there.
Got it. Yeah. I mean, I did like how the longer healthcare power of attorney, the agent form, had some, here's what I want you to do, but I just thought, 7 pages, some people are just going to be too intimidated.
And see, isn't that interesting, Betsy? Because I thought, I don't want any of that, so I deleted it from mine and made it much shorter. And deleted it from my, my kids that are in college. So, and one of those, the one in Oregon, he had to have an Oregon notary do it at his bank there in the Massachusetts. And those forms, so we get them from all over the country, and they're valid here as long as wherever the notary signed it. So,
Betsy, I'm sorry.
Got it. Thank you. Okay, you calling on me?
Yes, I am. Go for it.
Okay, I don't want to speak out of turn. I would never do that.
I would always do.
I'm wondering if anybody has dealt with the fact that banks often won't notarize advanced directives anymore, including my own bank, which just makes no sense because a notary is only verifying that the signer is a person. So
I can answer that question, Betsy.
Okay.
The State Employees Credit Union got caught in a lawsuit where there was a contested will, and their employees spent hours and days and whatever in court, and I know that's when they stopped notarizing because it took their employees' time, and they had just notarized the signature.
Wow.
The reason is I could analyze why that happened. It's annoying as anything, but the reason why is the same thing with healthcare power of attorney. The people who witness it cannot in any way be a part of your healthcare decisions or be part of the healthcare process. So in the sense, and I just had to deal with this 2 weeks ago, you can't, if someone's living in an assisted living or a nursing home retirement community, nobody there can be the witness because they are potentially receivers of finances and healthcare decisions, or they just don't, and so blah, blah, blah. So when I had to go and notarize a document, I literally had to ask the front desk, who is in this building right now who is not a staff member? And there were 2 visitors of other family members, and I had to track them down and say, could you do this because it's considered a conflict. So if you take that concept towards banks, because the financial power of attorney will be working with the bank, it makes the bank, in a sense, part of I can't find the words, but they can't also notarize because they're part of the implementation. If that makes sense.
No, that makes sense for financial things, and thank you for that bit. I'm just listening. I'm not watching, so I can't tell who said that about the lawsuit, but now I can answer people's questions.
But it's interesting because Wells Fargo, it notarized both my children's documents, one in Oregon and one in Massachusetts, because that's where we bank. They had to ask strangers to be the witnesses, but the bank
Mhm.
notary was willing to notarize it.
Yeah,
That's
because I
good
make
to
a
know.
distinction between a healthcare. I get it about financial things or a will, but for a healthcare property, I don't get why they won't do it.
Well, then it goes
But
to the specific bank and what kind of, as Vicky said, what kind of risk they're willing to open them up
Right.
to. And
yeah,
so then instead
Mhm.
you've got, I mean, my parents had to bring in just tons of stuff to UPS. And I'm looking, the inventory staff of UPS signed all of, and then it was like $15, 10 to 15 per signature. So it gets up there.
Mhm.
So it is, that's why us notaries that are not connected to are sort of helpful, but it is fascinating.
Yeah.
Other questions? Well, Lisa, you did your job getting us going, and that's why I was like, all right, let's not worry about breakouts. I wanted us to be able to ask questions. I look around and many of us are living this every single day with the people that we're working with or for the changes we're trying to advocate for. So, um, Lisa, I did put in the chat, if you're able, a lot of selfish requests from me right now because I'm doing a lot of reporting both to funders and legislators. If you could share the Secretary of State slides when she was asked, why are you doing this? And she had to come back and be like, because you asked. If those are public slides about where this came from and why, I'd love to see that.
Yeah, I'll find out. It might, because yeah, I'll find out. It was shared with us in an email. But it was publicly recorded, so I'll find
Yeah.
out and then I'll email it to you.
Yeah, that's great because she's a public official that was reporting to other public officials. So,
Right.
but just in case, that's good prep for me to
Yeah.
see. But um,
And I think you already have the slideshow if you want to share it with everybody. I
oh
had
great.
emailed it back. Yeah.
Oh great. Okay, great. And I'll send that to
But I can email that again. So just let me know.
yeah, if you want, you can just email them two together, and then Jessica's amazing at turning them into links that then I can share back with the
Okay.
when I email out. Angela has shared that some people say that some UPS stores were not notarizing these documents either. It sounds like if some organization or business or group gets burned, that's why they stop. That's my sense, but um yeah, it is interesting. Which again, why I understand with the financial power of attorney, but the healthcare power of attorney, the more, well, funny, banks will do the healthcare power of attorney. I think they will. That's a hard call. I don't know.
Wells Fargo did it for both of my children.
Yeah, I could see them because it's not a banking issue necessarily. I could see them do the healthcare power of attorney, but not the
financial one.
Yeah. Any other questions for Lisa? Thank you so much.